This presentation is on anxiety in adolescents post-COVID-19. Kent Lake High School, located in a large suburb, is part of Kent School District, which is 47% economically disadvantaged. This school has a diverse community with much of its enrollment being minority groups. The school is primarily white but has high populations of other racial groups. The school is about equally divided between male and females, with the age range being between 14 and 18 years old. There are many impacts anxiety has on adolescents, not only emotionally, but physically as well. Some common examples of physical impacts of the disorder would be shortness of breath and elevated heart rate. Common emotional impacts are stress, persistent feelings of sadness and hopelessness, and suicidal ideations, which sometimes leads to suicide attempts. Many of these feelings can lead to drug use and dependence. Since the pandemic, the Center for Disease Control and Prevention reports that 1 in 3 high school students experience poor mental health, most of the time or always. And according to the U.S. Department of Health and Human Services, the prevalence of anxiety has increased since the pandemic, reporting approximately 32% of 13 to 18-year-olds having an anxiety disorder. This health department describes that the youth population, 1 in 5, are experiencing clinically elevated symptoms of anxiety, which doubles the number from the first year of the pandemic. An article published by UC Berkeley describes how anxiety in adolescents affects their daily life function. It discusses this health disparity that increases the risk of depression, substance abuse, and suicidality due to the difficulties with emotion regulation that is core to this disorder. This connected to another article published by the Journal of Child Psychology and Psychiatry, in which it describes how suicidal ideations is indeed common in adolescents, especially in those who have psychiatric disorders such as anxiety. Many factors that lead to the increased risk of suicide parallel with issues that anxiety is known to lead to, such as heavy drinking, illicit drug use, and sexual abuse from poor relationship choices. As this article describes the seriousness of suicidal ideations in adolescents, the reader who is aware of these parallels would recognize how vital it is to control anxiety. Additionally, since COVID-19, there has been an increase in school burnout and stress, which is linked with anxiety. The article discussed how the intense stress and emotional exhaustion from the disaster-like event is anxiety-provoking and is correlated with school-related burnout, as seen through reports of exhaustion and inadequacy. While this particular article studies French adolescents, it is also relevant to United States students due to the highly similar pandemic experience between the two countries. There are 4 specific determinants of health in this development of anxiety, this author noted: social, economic, healthcare, and environmental. The social determinant is linked to family dynamics that may cause stress, having poor support system, peer pressure, and even certain cultural constructs. Secondly, the economic determinants can be linked to difficulty affording basic necessities such as healthy food, healthcare, and housing. Third, healthcare is also a determinant, as if a student lacks health insurance coverage, then there is a decreased likelihood of the student having a primary care provider. Lastly, Western Washington's rainy, dark, and cold weather environment is also influential. The school's loud noises and sometimes harsh lighting can also contribute as well. Based on the Wheel of Interventions for the Minnesota Department of Health, the author determined 9 interventions. At the system level, surveillance, policy development and enforcement, and health teachings are all interventions that could be used to help the disparity at its roots. At the community level, outreach, screening, and collaboration are helpful interventions that impact the large scale of people. Finally, consultation advocacy, along with referral and follow-up, will aid in addressing anxiety on the individual level, which is most personal. The specific role of a school nurse in regards to anxiety is educating students and staff on recognizing anxiety symptoms, positive coping mechanisms, and anxiety management techniques. Additionally, they can help connect students with resources as needed. The student is able to help educate students and staff in the school about anxiety and help build awareness through health teaching, and also individualize and aid in identifying anxiety and generating solutions through consultation, which can be done directly with the student. It is also important for the nurse to tailor care for diverse populations. For instance, when ensuring equitable care and addressing those with limited resources, a nurse should look at the individual's needs and connect them with the resource they need to be successful. In acknowledging diversity, the nurse should recognize this student's anxiety triggers and offer appropriate interventions for this patient as an individual. And to be inclusive, it is necessary to ensure that all patients are assessed properly prior to discussions or education, such as ensuring translation services. Washington state's law requires public schools to provide access to behavioral health resources for conditions such as anxiety. The Kent School District offers Hazel Heart Counseling, which are virtual therapy sessions that can occur at home or at school, and Health Point, which makes quality care accessible to each individual. Additionally, Washington has regulations and guidelines for individualized educational plans, which is a special education service for those who have a disorder or disability that affects learning. The counselor and teacher determine the specifics of this plan, but the nurse can identify the need and recommend it.